The only way to know for sure if you're vitamin D deficient is by blood testing. However, there are some signs and symptoms to be aware of as well. If any of the following apply to you, you should get your vitamin D levels tested sooner rather than later.
Number 1. You have darker skin. African Americans are at greater risk of vitamin D deficiency. Because of having a darker skin, they may need as much as 10 times more sun exposure to produce the same amount of vitamin D as a person with pale skin. Our skin pigment acts as a natural sunscreen, so the more pigment you have, the more time you'll need to spend in the sun to make adequate amounts of vitamin D. Number 2. Head sweating. One of the first classic signs of vitamin D deficiency is a sweaty head. In fact, physicians used to ask new mothers about head sweating in their newborns for this very reason. Excessive sweating in newborns due to neuromuscular irritability is still described as a common early symptom of vitamin D deficiency. Number 3. You're overweight or obese. Vitamin D is a fat-soluble, hormone-like vitamin, which means body fat acts as a sink by collecting it. If you're overweight or obese, you're therefore likely going to need more vitamin D than a slimmer person. And the same holds true for people with higher body weights due to muscle mass. Number 4. Having a gut trouble. Remember, vitamin D is a fat-soluble vitamin, which means if you have a gastrointestinal condition that affects your ability to absorb fat, you may have lower absorption of fat-soluble vitamins like vitamin D as well. This includes gut conditions and inflammatory bowel disease. Number 5. You feel blue. Serotonin, the brain hormone associated with mood elevation, rises with exposure to bright light and falls with decreased sun exposure. In 2006, scientists evaluated the effects of vitamin D on mental health of 80 elderly patients and found those with lower levels of vitamin D were 11 times more prone to be depressed than those who received healthy doses.
Number 6. You're 50 or older. As mentioned, as you get older, your skin doesn't make up much vitamin D in response to sun exposure. At the same time, your kidney becomes less efficient at converting vitamin D into the form used by your body. And older adults tend to spend more times indoors. If you experience any of those symptoms, get a health checkup as soon as possible. Probably might be due to the lack of vitamin D, which can be easily fixed naturally in an early stage. As always, stay healthy. God bless you all.